One question that I want to ask, a last question for the two of you is, we know that some biologics are transmitted to the baby through the placenta, and that babies do have serum levels, for example, of certain biologics when they're born. Are there any considerations of issues there? Do we know anything about COVID when the mom is on a biologic in the baby?
Well, we don't have that data yet. As you might be aware, there's a national study looking at immune responses in babies who are exposed in utero to biologics. We don't have the results of that study yet, but it is the same thing. Those babies should still be kept at home. You know, even though it's difficult and everybody wants to see the cute baby, they need to keep their distance, and there'll be plenty of time in the baby's life to get to meet lots of people afterwards, but just keep those babies as healthy and safe and unfortunately isolated during this time.
Yeah, so I'd like to just add on that. So I hope if there are any pregnant women on the webinar, there is a national collaborative effort throughout Canada, so where we have clinics to be able to evaluate and provide guidance on what to do to the infants that are exposed to biologics from their mothers during pregnancy. And as you know, as Eric mentioned, many of these babies are born with drug levels that are actually higher than the mums. So there is obviously a thought that there is an impact on the immune system of the baby. Some reassuring data. I mean, this is still very early and there's a lot more questions and answers at this point, which is why it's important to better understand what happens to these babies. But when we do see them in their clinics, we do a few tests to see if there's any big impact on their immune system. I would say in general, the numbers look normal, the function look normal, but we give the same guidance which I would give at this point to any newborn born during this pandemic. It's like Cynthia said, it's not the time to have a big party. Hand washing, you know, stay home, avoid any infection at this point, because we don't know what the effect of the biologics on the infant, plus COVID, plus, you know, just being a newborn. So more data to come probably in the next few weeks and months, but at this point it's still early, and I haven't seen any report of any infant born to a mom with COVID on biologics and being infected. So hopefully we won't see too many of those.
Yeah, we're very early, and we'll see what develops, but I think your messages have been very clear. I appreciate the time that you spent, and thanks so much for joining us.